Have you ever wondered why so many men spend years worrying about changes in their sexual health without ever saying a single word about it? A respected urologist once shared something that completely changed the way I think about this subject. He told me, almost casually, that the biggest challenge he sees in men over the age of 60 isn't erectile dysfunction, low testosterone, or even prostate disease. It's silence. Not the kind of silence that fills a room, but the silence of men who notice something changing in their bodies and choose to carry the burden alone. They don't tell their doctor, they don't tell their partner. Sometimes they don't even admit to themselves that anything has changed. By the time they finally decide to ask for help, what could have been a simple conversation and an easily managed issue has often become much more complicated, emotionally exhausting, and surrounded by unnecessary fear. That single observation stayed with me because it reveals something that countless men experience, but very few discuss openly. There is an incredible amount of trustworthy medical knowledge about men's sexual health after 60, yet most people never hear it explained in a calm, respectful, and straightforward way. Instead, they are left with myths, embarrassment, internet misinformation, or the feeling that talking about intimacy somehow reflects weakness. None of that is true. Today, we're going to replace that silence with honest conversation because understanding what's happening to your body is far more empowering than worrying about it in private. Let's begin with what may be the most important truth of all. Changes in sexual function after the age of 60 are completely normal. They are expected, and by themselves, they do not mean there is anything wrong with you as a man. That point deserves to be repeated because so many people have spent years believing the opposite. Growing older does not mean you have failed. It does not mean you've somehow lost your masculinity or your value. It simply means your body is changing, just as every other part of your body changes with time. As men age, testosterone levels gradually decrease. Blood circulation naturally changes. The nerves involved in sexual response become a little less sensitive than they were decades earlier. These are ordinary biological processes that happen to nearly everyone. Just like your eyesight isn't exactly what it was at 30, your joints may ache more than they once did, or your muscles take longer to recover after physical activity. Your sexual response also evolves with age. Yet for some reason, society treats this one change differently. Instead of viewing it as another normal part of aging, many men quietly interpret it as proof that something is wrong with them personally. That belief creates far more suffering than the physical changes themselves ever could. One of the hardest burdens many older men carry is not a medical condition. It's the belief that they should somehow function exactly as they did in early adulthood. But the human body simply doesn't work that way. For most healthy men over 60, erections develop differently than they did decades ago. They often require more direct physical stimulation instead of responding instantly to mental excitement alone. They may take a little longer to appear, they might not feel quite as firm as they once did. None of these changes automatically indicate disease or failure. Medical research has consistently shown that these adjustments are a natural part of aging for the majority of men. They're not unusual exceptions, they're the rule. Understanding that simple fact changes everything because many men aren't actually struggling with their bodies as much as they're struggling with the fear of what those changes mean. Once anxiety enters the picture, even small physical differences begin to feel enormous. A slight delay becomes a source of panic. One disappointing experience turns into weeks of worrying that it will happen again. Before long, the anxiety itself begins interfering with normal sexual function. This creates a frustrating cycle. A perfectly manageable physical change becomes emotionally overwhelming simply because it has been interpreted as failure instead of adaptation. Breaking that cycle often begins with changing your expectations rather than changing your body. The second important truth is something every man should know because it has nothing to do with embarrassment and everything to do with protecting your future health. Persistent erectile problems are sometimes among the earliest warning signs of cardiovascular disease. This isn't meant to frighten anyone. It's simply one of the most valuable medical connections researchers have identified over the past several decades. The arteries that carry blood to the penis are much smaller than the arteries supplying the heart. Because they're smaller, they often show signs of narrowing or reduced flexibility much earlier. In other words, changes in erectile function may appear long before someone experiences chest pain, shortness of breath, or any other obvious signs of heart disease. That's why doctors increasingly view persistent erectile dysfunction as much more than a quality of life issue. It can serve as an early signal that the cardiovascular system deserves closer attention. Think about how important that really is. Your body may actually be giving you advance notice that something else needs attention. Instead of seeing erectile changes as an isolated problem, physicians often see them as an opportunity to identify heart disease, diabetes, high blood pressure, or circulation problems before they become far more dangerous. That changes the entire conversation. When a man tells his doctor he's experiencing consistent changes in his erections, he isn't bringing up a minor or embarrassing complaint. He's potentially uncovering valuable information about his overall health. Many cardiologists and urologists now work closely together because they understand this relationship so well. An issue that first appears in the bedroom may ultimately help prevent a future heart attack or stroke. Imagine how different that perspective is from the one many men carry. Instead of asking, "What's wrong with me?" the better question becomes, "What is my body trying to tell me?" That single shift in thinking removes much of the shame while replacing it with something far more useful: curiosity and action. I remember hearing about one man in his late 60s who noticed subtle changes in his sexual function but ignored them for nearly a year. He assumed it was simply part of getting older and didn't think much more about it. His wife gently encouraged him to mention it during a routine doctor's appointment. Reluctantly, he did. His physician immediately recognized the possible connection between erectile function and cardiovascular health. After ordering several routine tests, the doctor discovered early signs of arterial narrowing that hadn't caused any other symptoms yet. The man felt perfectly healthy. He wasn't experiencing chest pain. He wasn't short of breath. Without those subtle sexual changes, he likely would never have known anything was developing. Because the problem was identified early, he was able to begin treatment, improve his eating habits, become more physically active, and significantly reduce his long-term cardiovascular risk. His doctor later told him something remarkably simple but incredibly powerful. Your body was trying to warn you. Thankfully, you decided to listen. That story reminds us that sometimes the earliest signals our bodies send are also the easiest to ignore. But recognizing them early can make all the difference, not only for sexual health, but for overall health and longevity. And that's where the next important conversation begins: understanding testosterone, one of the most misunderstood topics in men's health today. One of the biggest reasons testosterone causes so much confusion is because it has become surrounded by two completely different extremes. On one side, there are people who treat every symptom of aging as proof that testosterone is disappearing and must immediately be replaced. On the other, there are those who dismiss it entirely, assuming it plays almost no role in a man's health after 60. The reality, as it usually is in medicine, sits somewhere in the middle. Testosterone naturally declines as men get older. This isn't sudden, and for most men, it isn't dramatic. Beginning somewhere in the 30s or 40s, hormone levels slowly decrease year after year. It's a gradual process that continues through later life, and for many men, it happens so smoothly that they barely notice it. Their energy changes a little, recovery after exercise becomes slower, sexual desire may fluctuate, but these changes often occur so gradually that they simply become part of everyday life. The important thing to understand is that this normal decline does not automatically require treatment. Many men continue living healthy, active, satisfying lives with hormone levels that are lower than they were decades earlier. Their bodies adapt remarkably well, and their overall health depends far more on lifestyle, cardiovascular fitness, sleep quality, and emotional well-being than on chasing the hormone numbers they had in their youth. That said, there are situations where testosterone levels fall significantly below the normal range, and when that happens, real symptoms can develop. A man may notice that his interest in sex has decreased substantially. He may feel unusually tired despite getting enough sleep. His mood might become noticeably lower, his motivation weaker, and maintaining muscle mass may become more difficult even when he continues exercising. Sexual performance may also become more challenging. The key word is may. These symptoms can certainly be related to low testosterone, but they can also result from many other conditions: poor sleep, chronic stress, depression, thyroid disorders, diabetes, medication side effects, obesity, or cardiovascular disease can all produce remarkably similar symptoms. That's why trying to diagnose yourself based solely on how you feel is rarely accurate. Instead of guessing, the smartest approach is also the simplest. If you genuinely believe your hormone levels may be contributing to ongoing symptoms, have a conversation with your physician. A basic blood test can provide valuable information. Doctors generally prefer checking testosterone levels early in the morning because that's when they naturally reach their highest point during the day. If an initial result appears unusually low, it's often repeated on another morning to confirm that it reflects a true deficiency rather than a temporary fluctuation. Only after those results are considered alongside your symptoms and your overall medical history can an informed decision be made about treatment. For men who truly have clinically low testosterone accompanied by meaningful symptoms, testosterone replacement therapy can be life-changing. Many report improvements in energy, mood, sexual desire, muscle strength, and overall quality of life. But it's important to remember that this is genuine medical treatment, not a shortcut to reclaiming youth. Like every legitimate therapy, it comes with benefits benefits as well as risks. Doctors must carefully consider heart health, prostate health, blood counts, sleep apnea, and several other factors before deciding whether testosterone replacement is appropriate. It requires ongoing monitoring and regular follow up, not simply receiving a prescription and forgetting about it. Unfortunately, modern advertising often tells a much simpler story. Online clinics, social media influencers, and supplement companies frequently promote testosterone as if it's the answer to nearly every problem associated with aging. They promise renewed masculinity, endless energy, and dramatic improvements with very little discussion of who actually needs treatment and who does not. That marketing can be incredibly persuasive, especially for men who already feel frustrated by the normal changes of aging. But medicine doesn't work that way. Taking testosterone when your levels are already normal isn't guaranteed to improve your health, and in some situations, it can create unnecessary complications. That's why decisions about hormone therapy should always be based on careful medical evaluation rather than persuasive advertising. Understanding that distinction protects men from both unnecessary treatment and unnecessary fear. The next truth is perhaps the most meaningful for couples who want not only to understand these physical changes, but to continue enjoying deeply satisfying relationships as they grow older. Sexual intimacy after 60 often becomes less about performance and much more about connection. At first glance, that idea may sound like a comforting phrase people use to soften the realities of aging, but the more researchers study long-term relationships and sexuality across the lifespan, the more consistently they hear the same message from older couples. Many describe their intimate lives as becoming emotionally richer than they were decades earlier. That may seem surprising in a culture that constantly celebrates youthful sexuality while rarely acknowledging what intimacy looks like later in life. The reason this shift happens is remarkably simple. When we're younger, many people unknowingly measure successful sex by speed, spontaneity, firmness, or frequency. Those expectations become deeply ingrained over time. Men often feel responsible for meeting a very specific standard of performance, and any deviation from that standard feels like failure. But aging quietly changes the rules. The body naturally slows down. Arousal develops differently. More time may be needed. More physical touch becomes important. Emotional closeness often plays a greater role than it once did. For couples willing to adapt instead of resisting those changes, something unexpected frequently happens. Pressure begins to disappear. Without constantly worrying about achieving a particular performance, many couples become more attentive to one another. They communicate more openly. They become less focused on rushing toward a destination and more interested in enjoying the experience itself. Instead of intimacy revolving around one physical outcome, it becomes a broader expression of affection, comfort, trust, laughter, touch, and mutual pleasure. Ironically, letting go of unrealistic expectations often improves sexual satisfaction rather than reducing it. This isn't wishful thinking. Sex therapists who spend their careers helping older adults consistently report that many couples experience greater emotional fulfillment once they stop comparing themselves to an unrealistic version of youth. They learn to appreciate intimacy for what it has become instead of mourning what it no longer looks like. The problem is that many men never give themselves permission to make that adjustment. They continue judging themselves according to standards that no longer fit their stage of life. That internal pressure becomes another source of anxiety. And anxiety is one of the greatest enemies of healthy sexual function. The human nervous system simply doesn't perform well when it's under constant stress. Fear activates the body's fight or flight response, redirecting attention away from relaxation and intimacy. The more a man worries about whether an erection will happen, the harder it often becomes for his body to respond naturally. That creates another self-perpetuating cycle. One disappointing experience leads to worry. The worry creates more difficulty. The additional difficulty creates even greater worry. Months later, what began as a perfectly normal age-related adjustment has evolved into a pattern fueled largely by fear, rather than by worsening physical health. Breaking that cycle often starts with something surprisingly simple, changing the definition of success. Instead of asking whether everything happened exactly the way it did 30 years ago, many couples begin asking a different question. Did we feel close? Did we enjoy being together? Did we leave the experience feeling connected? Those questions often produce far healthier answers. Of course, emotional connection is only one piece of the puzzle. There are also practical medical factors that deserve attention, and one of the most overlooked involves something millions of older men take every single day without realizing it could be affecting their sexual health at all. That's where medications enter the conversation, and understanding their role can sometimes provide one of the simplest and most effective solutions of all. Many men spend months, sometimes even years, believing that age alone is responsible for changes in their sexual health, when the real explanation may be sitting in the medicine cabinet they open every morning. This is one of the most overlooked aspects of men's health after 60, and unfortunately, it's also one of the least discussed. Unless a patient brings it up directly, Ironically, doctors often don't have enough time during a routine appointment to review every possible side effect of every medication. As a result, countless men quietly assume they're experiencing an unavoidable part of aging when in reality the cause may be both identifiable and treatable. The truth is that many commonly prescribed medications can influence sexual function. Drugs used to manage high blood pressure, certain antidepressants, medications for enlarged prostate conditions, and even treatments prescribed for completely unrelated health issues may interfere with libido, erections, or sexual satisfaction. None of this means these medications are bad or should be stopped. In many cases, they are essential for protecting a person's long-term health. The important point is simply recognizing that side effects exist and that sexual changes should never be dismissed without exploring every possible explanation. What makes this especially frustrating is that many men never think to ask whether their medication could be contributing to the problem. They simply connect the timing to their age. If the difficulty appeared sometime after turning 60, they naturally assume getting older is entirely to blame. Yet physicians frequently discover that the situation is much more complicated than that. Sometimes a medication that's doing an excellent job controlling blood pressure is also reducing blood flow in ways that affect sexual performance. In other situations, an antidepressant may be improving emotional health while simultaneously lowering sexual desire or making arousal more difficult. Medications prescribed to relieve urinary symptoms caused by an enlarged prostate can occasionally produce similar effects. These possibilities are well known within medicine, but they often remain unknown to patients. Fortunately, this is where an honest conversation can make an enormous difference. Doctors frequently have several treatment options available for the same condition. If one medication is creating troublesome side effects, another may provide similar health benefits while having much less impact on sexual function. Sometimes adjusting the dosage is enough, sometimes changing the timing of when a medication is taken helps. Occasionally, another treatment approach may be more appropriate altogether. None of those possibilities can even be considered, however, unless the concern is raised openly. I've heard more than one story from men who quietly accepted changes in their sexual lives for years before finally mentioning them during a routine appointment. They expected to hear that nothing could be done because they were simply getting older. Instead, their physician reviewed their medications, identified one likely contributor, switched them to an alternative, and within a matter of weeks, they noticed remarkable improvement. For those men, aging hadn't been the primary problem at all. It wasn't declining masculinity, it wasn't an inevitable loss of function, it was a medication side effect that had gone unrecognized because nobody had connected the dots. Stories like these remind us why assumptions can be so misleading. The body is influenced by countless factors working together, and sexual health is rarely determined by a single cause. That's exactly why professional evaluation matters so much more than self-diagnosis. Another topic that deserves equal attention is prostate health, because after 60, sexual health and prostate health often become closely connected. The prostate is a small gland, but it plays an important role in a man's reproductive system. As men age, changes involving the prostate become increasingly common. Many experience benign enlargement that affects urination. Others may develop inflammation or other conditions requiring medical treatment. And of course, prostate cancer becomes more common with advancing age, making regular discussions about prostate health an important part of overall preventive care. It's worth emphasizing that recommendations regarding prostate screening have evolved over the years. Medical organizations continue refining guidance as new research becomes available, which is why there isn't always a single answer that applies to every man. Age, family history, overall health, life expectancy, and personal preferences all influence screening decisions. That's why these conversations are best held directly with your physician rather than relying solely on articles, internet forums, or social media advice. One of the reasons prostate health deserves careful attention is because both prostate conditions themselves and the treatments used to manage them can sometimes affect sexual function. Surgery, radiation therapy, hormone treatments, and even some medications prescribed for prostate enlargement may influence erections, ejaculation, or sexual desire. These possibilities understandably create anxiety for many men, especially when they first hear about them. But anxiety should never replace information. Modern prostate care has advanced tremendously over the past several decades. Specialists today understand that preserving quality of life, including sexual function whenever possible, is an important part of treatment planning. Urologists regularly discuss these concerns with patients before recommending specific therapies, helping men understand both the benefits and the potential trade-offs involved. The earlier these conversations begin, the more opportunities exist to plan carefully and make informed decisions. Waiting until treatment has already started makes those discussions much more difficult. That's why asking questions early is one of the smartest things any patient can do. If you're facing prostate testing or treatment, don't hesitate to ask how it may affect intimacy, what options exist to reduce those effects, and what rehabilitation strategies might be available afterward. These are not uncomfortable questions from a medical perspective. They're routine parts of caring for men's health. Unfortunately, many men still hesitate because they believe discussing sexual function somehow makes them appear weak or self centered in the middle of a serious medical condition. Nothing could be further from the truth. Quality of life matters, healthy relationships matter, emotional well being matters. Every experienced urologist understands that preserving those aspects of life is just as important as treating disease whenever possible. After discussing all of these medical facts, though, I find myself returning again to the issue that started this entire conversation: silence. Because if we're honest, silence often causes more damage than the physical condition itself. There's a pattern that repeats itself over and over again in the lives of many men. At first, the changes are subtle. Maybe an erection isn't quite as reliable one evening. Perhaps desire feels a little lower than usual. Maybe intimacy simply doesn't unfold the way it always has. At this stage, it's easy to explain it away. It's probably stress. I didn't sleep well. I'm just tired. It'll be better next time. Those explanations sound reasonable because sometimes they're completely true. Everyone experiences occasional changes. The problem begins when those occasional experiences slowly become more frequent. Weeks pass, then months. The man notices the pattern but keeps it entirely to himself. He doesn't want to worry his partner. He doesn't want to admit that something may have changed. Most of all, he doesn't want to believe that speaking the words aloud somehow makes them permanent. So instead, he waits. And while he's waiting, something else quietly grows alongside the original problem: anxiety, not dramatic panic, not overwhelming fear, just a steady background worry that follows him into every intimate moment. He starts wondering whether the same thing will happen again. He begins anticipating disappointment before intimacy has even begun. Without realizing it, his mind gradually becomes focused less on enjoying the experience and more on monitoring whether everything is working the way he hopes. That shift in attention changes everything, because sexual arousal depends heavily on relaxation, confidence, and a calm nervous system. When worry becomes the dominant emotion, the body's natural responses often become much more difficult to achieve. And before long, what started as a relatively small physical adjustment has become something much larger. Not because the body has dramatically worsened, but because fear has quietly woven itself into every experience. Understanding how that cycle develops is the first step toward breaking it. And the most powerful way to break it isn't through secrecy, it's through honest conversation, both with the people who care about you and with the medical professionals who have helped thousands of men navigate exactly the same concerns.